Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Good evening. It's always a pleasure to join you every Thursday evening in your homes to bring to you your week's favorite health talk show, The Doctalk Show, where we made a pledge to focus on your health because your health is your wealth. So we are all out to get as much information about health so that throughout the whole year you keep healthy and you're in position to make as much money as possible. I'm your host, Dr. Garvin Nyanzi, and it's an honor to be here this evening. And this show is brought to us by Camelin Men's Collection. For all the guys out there who want to look awesome in 2022, Camelin is the place to go to get blazers like the one I'm putting on this evening and many other men's products. It is found at Zebra Plaza, that is on the top of Entebbe Road, intersection with Kampala Road, and you will never be disappointed. We also recognize the national medical stores who have continually partnered with us to make this show available. And this evening again, we are going to discuss about something very important and many times not given attention, but it's something that is important and present with us. And unless we shed light upon it, many of these things will go unnoticed. We're going to be discussing about eating disorders, probably hearing it for the first time, but many of us have heard about it, but rarely do we see it being talked about. And so in studio with me tonight are two guests. Just next to me is Felista Nakasita. She's a nutritionist.
Thank you very much. Good evening, viewers.
And next to Felista is Elizabeth Namukose. She's a clinical psychologist working with the same hospital. Welcome, Elizabeth.
Thank you very much. Good evening, viewers.
Wow. Yes, Felista. Please roll us away. Eating disorders. What is this animal called eating disorders?
Well, eating disorders is something very new, and I'm sure many people don't know about it. But eating disorders are basically psychological conditions that lead to poor eating habits.
Okay.
What do I mean by poor eating habits? It's either you are eating too little or you are eating too much. And in the scenario where you are eating too little, of course, you are not meeting your body needs.
Okay.
And when you are eating too much, you are giving the body a lot that it doesn't need. So it's basically around conditions that lead to poor eating habits. Yes, that's what I would say.
Is this a big problem?
Yeah, it's a very big problem because if you're not eating enough, then of course you can't be productive.
Okay.
And if you're eating too much, then you lead into conditions like NCDs. We have now the NCDs, the non-communicable diseases, and these things include things like cancer. We have the diabetes, we have the high blood pressure, and it's a very big problem in our community right now.
Is it common? Is it these eating disorders, are they common in our communities?
Well, I think it's something people silently suffer with. It's not very common that people come out and say, hey, here, I have this eating disorder. So I think people silently suffer with it. But there are cases in the community just because maybe people don't openly come out to talk about them. Yes.
Yes, Elizabeth, what has been your experience with this animal, eating disorders?
There's quite a number of mothers I have encountered with also children, especially maybe the pregnant mothers. If they do not eat enough, they actually end up getting malnourished children. And that actually affects their growth, children's growth. But also for the children or the people I've encountered, sometimes there's so many emotional, psychological issues that they are not aware of. So they end up eating unnecessary eating that makes them maybe grow big. And it affects them, really. It affects them.
So from what you're saying, these problems, or this problem, the issue of eating disorders, cuts across all ages, from children all the way?
Yes.
Okay. Felista, so are there types? Do we have types of eating disorders? What are
Well, there are, of course, with ongoing research, many new eating disorders come up, but we commonly, they are mostly the four most common ones, and which include anorexia nervosa, there is bulimia nervosa, binge eating, and of course the pica. Those are the four main types.
Okay.
But of course, with ongoing research, new other eating disorders always come up.
Okay.
Yes.
Anorexia Navosa. That sounds like Japanese. My viewers, what is that?
Well, basically, anorexia nervosa is a type of eating disorder where people are very picky about what they eat, in that they try to avoid certain foods, or they end up restricting their diet so much that they can't meet their calorie needs or their nutrient needs. And on top of this, such people also like to exercise a lot, so they end up being underweight. And they always perceive themselves as being overweight, even when they are underweight.
Okay.
So yes.
So in other words, instead of having our recommended balanced diet, fruits, vitamins, we have fruits and vegetables, carbohydrates and proteins. So somebody may just restrict themselves to carbohydrates, and so they miss out getting on these other nutrients, or restrict themselves to vitamins only, and so they don't get...
They don't really restrict themselves on a certain type of nutrient, but they eat very small portions that can't meet their nutrient needs. For example, one person will be like, I'll be eating one Irish potato maybe for lunch, which is very small to meet all the nutrient needs that the body needs.
Wow.
Yes, yeah.
And this is a common problem?
Well, I can't say it's common, but of course there are individuals out there who may have this problem. Actually, they may not notice that they have this problem because it's not something that is openly talked about. Usually we are used to our diseases like diabetes, the hypertensives, but it's something, these eating disorders, as I said earlier on, it's something new, something that has not really been taken on here in Uganda, I would say.
Okay.
Yeah, so it's people are there, they have it, but they silently suffer with it, and they may actually not know that they have an eating disorder, maybe because they are not knowledgeable about it.
Okay.
Yes.
And you've told us about bulimia nervosa.
Yes.
I would imagine it's the opposite.
Yeah, like you said. Well, when it comes to bulimia nervosa, these people actually now end up eating a lot than they need. A person would eat more in a setting, and what usually happens when they eat all that food, they end up purging it. What I mean by purging is like getting rid of it. Either they force themselves to vomit so that they can get rid of that food.
Okay.
Yes, so it's quite the opposite of anorexia nervosa, where these people eat little, but in bulimia nervosa, they eat big quantities and end up forcing themselves to vomit so that they get rid of that food.
Does that mean they will also be small?
Yeah, most definitely they are going to be small because if you eat the food and the body is not utilizing that food, of course, definitely you are going to be small.
Wow, so it doesn't necessarily mean that bulimia nervosa, somebody will put on weight.
No, they
Because
will
they eat and then they throw it up.
Yes, as I said, they throw it up.
Yes, Elizabeth, and probably tell us about the other two eating disorders.
Maybe before the other two disorders, you find that in each of these things that Felicitas has explained, we find that there's either low self-esteem and someone wants to maintain the status, maybe the size, or someone wants to be a bit bigger than slender. So you find that there is something this person psychologically, emotionally, this person is fighting certain things. So you find that at the end of the day, once this person is not really in the good emotional, psychological state, will end up in those types of
Eating disorders.
Eating disorders.
Okay.
Yeah. So like maybe like the pica. Pica is where you find that someone is eating maybe soil from certain things, but sometimes it comes way back from maybe the pregnancy. The mother could love maybe like there's something they call a mumbwa.
Soil.
So someone may want to eat that. So you find that even when the baby grows up, may want to eat those soil, picky, some maybe peppers or chewing nails, maybe child is moving or someone grown up moving and maybe picks a leaf
and begins chewing at it.
Starts chewing. So that
sometimes the child is exposed because of what the mother did while she was pregnant. We are taking a break, and special thanks to our sponsors, Camelin's Men's Collection at Zebra Plaza, as well as National Medical Stores, for always making this show available to us every week. Please share our links, because we are live on our Facebook as well as YouTube channels. Share the link with your family and friends. Let everybody get to watch and hear this very important information. See you in a bit.
You are watching the Doctalk Show. You are watching the Doctalk Show.
Thank you for keeping it here with us. Those that are just joining us, this evening we are talking about eating disorders. A very big problem, but very silent. Sontoro is talked about. And in studio with me, I have got a nutritionist as well as a clinical psychologist who are here to help us understand this very big problem. Felista.
Yes, please.
Yeah, before we broke off, we had looked at the 4, and there was something called binge eating. What's that about?
Well, binge eating, it's a term basically where you eat too much in a certain setting. For example, if you are on a dining table, you'll notice this person is eating way much that they actually need. So they'll be taking on a lot of foods at the same time. That's what we call binge eating. Eating too much in a certain setting.
Okay.
Yes.
Is it the same thing? Usually when I go out for Kwanjula parties, you find somebody does put, self-service, Somebody puts and you almost can't see their face. There's a whole mountain. Is that what exactly happens?
Oh, at that moment, yes, it's binge eating.
Okay.
But then, of course, when you take it on as a habit, then it becomes a disorder. Yes.
So
but
if I do it once in a while, it's not a disorder.
No, it's not really a disorder. But when it becomes a habit that you actually eat too much in a certain setting, then it becomes a disorder.
Okay.
Yes.
And I guess still with binge eating, somebody will be predisposed to the non-communicable diseases.
Yes, of course, you are predisposed to the non-communicable diseases because you are eating in excess calories. You are eating more than your body needs. So when you eat a lot, of course, the body ends up storing it as fat. Okay. That's when you start putting on weight, then you become overweight, then eventually obese. Yes.
Wow. Yes, Elizabeth.
Yes.
What are the causes? Why do people end up having these issues? These the 4 things we've mentioned above. What's the matter? What brings about these issues?
With the emotional psychological disorders that are leading to eating disorders, most times there must be an event or a situation that one is going through, or that person is going through, or has gone through. So you find that most times if the parenting is not good, like you do not measure the amount of food for your child from the very beginning, this is going to manifest in some party somewhere where someone will serve and forget that there are other people in the party who need to share. So sometimes poor parenting.
Poor parenting, okay.
Poor parenting. Sometimes it can be childhood experiences. Childhood experiences, like some children do not have what to eat and they are going there and there. It could be rejection.
Okay.
To find something to eat.
So they find comfort in eating.
They find comfort in eating. It could be low self-esteem because of certain things that this person is going through. So you find that I just have time to go to eat. And you find them eating things that are not actually necessary for them. Okay. Now, some people, it might be stress. Stress is just a leaf in the emotional psychological health. It's just a leaf. But that stress can make you, can endanger your life.
Tip to the side of
exactly.
Eating disorder.
Yeah, it can be burnout at work, like you work and work, fatigued, and you end up eating to give you comfort, It can be
mourning, somebody has lost somebody.
Death. It can be death. Yeah, it can be death, it can be rape, it can be racism, it can be, it can be, so it comes
many
because there is
affecting your emotions.
Exactly. So long as your quality of life is affected, you might end up in the eating disorders.
Oh, okay. Yes, Felista. Any other causes for these issues?
Well, among other causes, I'll pick on picker. Actually, some research has shown that pica is actually caused due to nutrition deficiencies.
Okay.
For example, if someone is anemic, they may end up craving soil. That's one example.
Okay.
Then, of course, also personal traits. Some people are too much of perfectionists. They want things in a certain way, in that they want to be very picky about their food. And also, other research has shown that it could also be genetic, like it could run in the family.
Okay.
There's a research they did where it showed that if a twin actually develops an eating disorder, then most likely the other twin is also going to also develop the eating disorder.
Wow.
Yes, please.
And what happens for the models? Would
Well,
that be a problem? Models, I know they always talk about figure 8. I've seen very slender people. What happens?
Well, okay, I didn't talk about also the societal pressure. I think we live in an era of social media. And I feel sometimes people want to perceive a certain image. You may look at the models, the musicians. They tend to be slender. They tend to be a certain size, sorry. So you may feel actually upon you that you may have to maintain a certain size. So in the eventuality of carrying on that habit, you end up developing eating disorders. Well, the models, I would say, models, of course...
Would it be a professional hazard for them?
Okay, I would say that, but I think with models, they work with professional nutritionists, in that they plan their meal plans in order to say a certain size. But when you actually now start eating less than your body needs, then of course it becomes an eating disorder.
So for the models, they plan they get the calories, able to keep them in that.
Yes,
they
they
have
plan.
Professional nutritionists
Yeah, they
help
have
them on that
professional
journey.
nutritionists in order that help them stay a certain size. But when you're not having help from someone and you want to attain a certain size, most times you're going to end up being underweight because your nutrient content is not being planned accordingly. Yes.
Okay. Elizabeth,
Yes.
from your experience at work, what has been the commonest of these that you've encountered? Maybe in your workplace or people that have called you to, seek some counsel. What has been the commonest around town?
The commonest is could be like for the mothers. It could be malnourished children, like they are born small.
Okay.
And of course, to be able to help this, the mother needs to eat her breast milk to feed the baby who was already malnourished in there. So you find that sometimes if emotionally this lady was stressed, the milk disappears.
Okay.
And that affects the baby, but also the mother.
Okay.
Then also the quality of life. You find that someone's quality of life, maybe the sleep is affected, social life, this person is no longer free with others, so may hide to eat. In the performance at work may not be good because maybe this person is fearing to appear or not to, the quality of life generally can be affected.
When I was in high school, I remember a number of my classmates, okay, not a number, some, especially girls, they used not to show up at the mess, we used to almost lift the mess for the boys. So is it especially anorexia navosa, is it a very common thing among the school-going girls?
Yes, of course, anorexia nervosa is most commonly among teenagers, adolescent girls, and of course young women. Because as I talked earlier on, we have this societal pressure. You want to perceive a certain size, a certain image. So in order to maintain that image, you end up missing meals, you end up eating less than your body needs. So yes, it's actually common among adolescent girls and the young women due to societal pressure. Yes.
Okay. So the parents watching us tonight need to take heed, trying to follow up actually on the eating habits of our children, especially those in high school, and I think even some university students,
Sure.
The posho and the beans, I think, are very healthy foods for especially school-going kids because there is a lot of energy that is needed for them to while they're reading and all that. But some of them end up, even in schools, I know there are canteens, they end up going for the chips, crisps and all that, which eventually affects them. isn't it?
Yes.
It's true,
Okay.
true.
Still to Felista, is pica still a very common thing from your practice?
Well, I haven't encountered someone with pica, but I have childhood memories where I remember children eating chalk. Yeah, and personally, me as an individual, when I was growing up, I was quite addicted to eating soil.
Okay.
Yeah, so I think these habits are there, but because maybe we're not aware what they actually mean, we just perceive them as being maybe a short-term habit. I like, oh, maybe they'll outgrow it.
Okay.
But yeah, they're definitely out there, but of course they will not openly come out and say, maybe, look here, my daughter maybe is addicted to eating chalk, or my son is addicted to eating soil. So I think parents just think that it's something they'll outgrow with time.
Okay.
Yeah.
Wow. Elizabeth, I know you work in a hospital setting. Do the other medical cadres, maybe the doctors, the clinicians, nurses, are these things actually they usually talk about? Maybe when they're taking their history, is it something they give attention to, the eating disorders?
Some yes, some are not, but we really need to make sure that while taking the examination or the assessment history, to
You should be sensitive to look out for that.
You should be able to take note of the eating disorders, because these are some of the things that actually affecting the quality of life of so many people.
Okay.
So many people, right from children to very old.
Wow. Thank you very much. And we are taking a break about now. Special thanks to Carmeline's Men's Collection and the National Medical Stores for bringing this show to us. Follow us live on Facebook and YouTube. Please share that link with your friends. Invite them. Let's learn together and empower one another. See you in a bit.
You are watching the Doctalk Show. You are watching the Doctalk Show.
Thank you for keeping it with us. We are here this evening discussing eating disorders. And for you who has just joined us, we are in studio tonight with a clinical psychologist and a nutritionist. There's no better combination we would have to handle this topic. And if you've not yet shared the link, please do. We are live on Facebook and YouTube, the Doctalk Show. Share with your friends, invite some of your neighbors into your living room, and let's empower one another. Felista, you know, we've talked all this about the eating disorders. What are the effects? What are the consequences? Most likely there are no good consequences out of these. What are these things that come out as a result of these eating disorders?
So basically, as I had said earlier on, eating disorders either lead to eating less or eating too much. So when it comes to things like anorexia nervosa, where you're having a very strict diet, you end up not meeting your nutrient need. We have what we call the dietary allowance of a day. So you end up not meeting your nutrient needs for that day. And of course, when it becomes long term, you end up getting things like being underweight, meaning your body is not getting enough food to sustain the body functions.
Okay.
So you end up being underweight. And of course, when you become underweight, of course, you have other nutrition deficiencies that are associated with it. For example, things like being anemic. When you become anemic, of course, you can't be productive. You're less productive. You can't concentrate. So, of course, all those are effects of this. And in the long term, if you're not eating enough, of course, then the body organs can't function. The body organs will end up failing.
Okay.
So, of course, all of those are consequences of not eating enough food. Then, on the other side, when you're eating too much, of course, binge eating. You are taking in more than your body needs. Of course, the body picks what is enough for it and converts the rest to fat. So in the long run, you end up being overweight, and if this is not managed, you become obese. And of course, with the obesity, with the increased fat in the body, other illnesses set in. We have things like diabetes.
Okay.
We have things like high blood pressure. We have things like the cancers, which we now call the non-communicable diseases these days. Of course, all of those are going to are going to set in. Then when it comes to pica, as my colleague had talked about it earlier on, pica is mainly eating non-food substances, things like chalk, things like soil. So when you ingest all these things, of course, they're not adding value to the body.
To the body, yeah.
Yeah, the body is not getting any nutrients out of them. Of course, when the body is now, you're not meeting the nutrient needs, you're going to have nutrition deficiencies I talked on earlier on. You're going to become anemic and all those other nutrition deficiencies. So yeah, these are some of the effects that are going to happen.
Wow. Elizabeth,
Yes.
I know your line of focus, emotional, psychological. Are there such anything? I know there could be still negative consequences in that line.
Yeah. Yeah, you find that many times you fall a victim of low self-esteem, poor sleep, poor appetite, your quality of life, like performance is affected, your parenting is not good because you're always quarrelsome, very short-tempered, you don't adjust very fast, you have always a problem with adjustment problems, you can get insomnia because you're thinking of, oh, what will I eat tomorrow? Something like that. Then you find most time you cannot keep relationships, because of a lot of emotional, psychological distress around these eating disorders.
Okay.
And there are so many effects, by the way, so many. We can't finish all of them here. Yeah. So you can end up depressed. You can end up in anxiety of who you are. It affects your perception, how you look at people, how you look at yourself, how you look at environment. It affects even the thinking, the decision making.
Okay.
Yeah, doctor, there are so many.
Wow.
Well, I would like to add on these comments. When you look at things like anorexia nervosa, of course, if you're not eating, then most likely you will develop ulcers because you're not getting enough food. Of course, the acid is going to be produced in the stomach and it's not going to find there any food. And when you look at bulimia and nervosa, where someone is forcing themselves to vomit, like
Bulimia, you say they eat so much and then they vomit it out.
Yeah, when you're vomiting all that food, of course, you're going to get things like a sore throat. Because remember, we have that acid being produced in the stomach, and then when you're vomiting, it's going to burn the throat. Then you also have things like tooth decay, because those acids corrode the teeth. You're going to end up getting tooth decay. Yeah, thank you.
So really, this is a big problem, which unfortunately has not been given that attention it deserves.
Yes.
But I hope as people continue to watch this, even a number of policy makers, they will be able to give it the attention it deserves, because it's a problem, but it's common with us, and the outcomes or the consequences are quite enormous and on the negative side. Yeah, so how does one, maybe a mother out there watching us, and maybe they do not know if their child actually has this problem, what are the telltale signs? What will they be looking out for? What are these maybe signs and symptoms that people, to help the medical person to really make the diagnosis?
Well, okay, what I can think of, especially for anorexia nervosa, since it's the main common one, of course, people are going to be skipping meals. Someone will not want to eat meals. Or if they are eating the food at all, they are very picky about what they eat. For example, as I said earlier on, they'll be picky, like I'll be eating one Irish potato, maybe one vegetable like that. So they are very picky about the food they are eating. When you're on the same setting, either they are eating too little or they don't want to eat the meals at all. They'll be missing some meals eventually.
Okay.
Then, of course, for things like bulimia nervosa, of course, they'll be on the table eating all together. But you'll notice this person is eating way too much than they'll be eating a lot. And actually, when they finish eating, they'll want to excuse themselves in order to go and purge or vomit the food. So I think those are some of the things you can look out. Then the very evident ones like pica, of course, you'll notice that your child or a pregnant woman is eating non-food substances. Maybe they're eating soil. Maybe your child is eating chalk, or your child is eating peppers. Some of these things as a parent, you may not notice them at home, but actually with the help of teachers, they can actually tell you, oh, maybe your child is eating chalk at school, or maybe your child is eating peppers. So as a parent, maybe you may not be there to monitor the child all the time since the children are going to school. But actually, with the help of the teachers, they can help to identify a few of these eating disorders.
Wow. Yeah. So actually, even for the teachers, and actually they play a very, very important role because they are with their children the biggest part, the biggest portion of time. Actually, these kids are in school. Yes. So the teachers also play a very important role. I hope the teachers that are watching tonight are picking up these very telltale signs that when they really notice them, they can be able to recommend intervention as soon as possible. Yes, Elizabeth, any other signs probably from your angle that...
From the children's side, they could be having disassociative behaviors. Like you may call them, maybe they are fearing to eat certain foods, and they tend to look like they are not hearing you. Disassociative behaviors. Could be anxiety, then depression, failing to adjust. Those are some of them.
So as people present with these symptoms, we should always actually try to examine or look out for the possibility of a nutritional disorder, an eating disorder.
Yes.
Wow. Thank you very much. We are going to take a break in a minute, and special thanks to our sponsors, Chameleon Men's Collection at Zebra Plaza. If you want to be very smart like I am doing this evening, if you want your boyfriend or husband to look like me, that's the place to go. If you have any interviews this year to go for, please go to Chameleon Men's Collection. That's on top of Entebbe Road, intersection between Entebbe Road and Kampala Road, and you'll not be disappointed. Special thanks to National Medical Stores for bringing this show to us every week. And please continue to share our link with your friends and family, the Doctalk Show on YouTube and Facebook. Let's spread the good news. We will be back in a moment.
You are watching the Doctalk Show. You are watching the Doctalk Show.
Thank you for keeping it here with us. And we are back discussing eating disorders. And in studio with me is Felista, a nutritionist, as well as Elizabeth, a clinical psychologist, who are doing justice to this topic this evening. For those that are just joining us now, commonly we have 4 eating disorders where one can choose to eat so little, and so they end up actually losing a lot of weight, where one can choose to eat so much, but immediately after eating, actually they vomit everything and still keep small. Then we have what we call binge eating, where somebody eats too much. Probably you've experienced this at some parties you've gone to. And then the other ones where people eat non-food substances. These things are present with us, and many times they go unnoticed, and actually our sisters, our brothers end up suffering and being unattended to. But I believe after tonight's show, we are all going to be agents of change, agents of change concerning this issue. Elizabeth, now that we've seen all this, what interventions do we have in place? What should people expect when they come to our hospitals, when they come to our clinics? What interventions should we expect?
Immediately after the clinical assessment, of course, they will identify now that we've talked about eating disorders. And once it's identified, then most times they will send them to a clinical psychologist who will be able to do a psychological test or a psychometrics to identify what percentage or at what range is this disorder bad. Then after that, of course, they will give psychotherapy to try and re-educate this child or this person on how to take care of himself or herself on the eating disorders. Of course, together with the nutritionist, we work hand in hand with other medics so that we can be able to see how do we take care of this person's quality of life and health. Now, after the psychoeducation, there's a lot of individual therapies, family therapies, where the families will have to come in to get to know how do we to understand what eating disorders is and how is it affecting the person's quality of life. And after that, the family and together with the person who came, identified client or patient, is helped to get more psychosocial support on this disorder, so that they know it's a problem but can be helped.
Okay.
And the family will be helped to do that.
So you offer support both to the patient as well as the entire family.
Yes.
And there is actually people can come out of these things once helped.
Yes.
In time.
Yes.
Yes, Felista, what other interventions do you have in place?
Well, I would like to echo my colleagues' comments. I think eating disorders really need a lot of psychological support.
Okay.
Because ideally, as a nutritionist, no matter how much I tell you to eat a certain type of food, without changing the mindset, then it can't work. But with the psychological support and the nutritionist, we can work together to see that this patient actually improves and maintains a certain healthy weight status. So my part as a nutritionist, of course, I usually do what we call nutrition assessment.
Okay.
So when you come in, I usually do what we call body mass index. Body mass index is a good indicator to help me know whether someone is underweight, whether you're overweight, whether you're obese, or you're just normal.
Body mass index is the relationship between your weight and height.
Yes, and the weight and the height. So when I actually get your weight and the height, then I can either determine whether you are underweight, whether you're normal, overweight, or obese. So when I have that, then I work upon, depending on what you present with. Of course, when you're underweight, with the help of psychosocial support, I help you understand what foods can you eat in order to regain your weight. Because at the end of it all, the main goal is regaining a healthy weight. You have to be in the normal range.
Okay.
You have to have a healthy weight status.
Okay.
So we have to ensure that you have a healthy weight. And of course, with help, you can understand that you can actually eat this a certain type of foods and still maintain the weight. It also works for those people who are overweight and obese, or the ones who binge eat. We help them in order to regain the normal weight status. Of course, we draft out the various foods that you're supposed to eat, of course, being balanced to ensure that you remain with a healthy weight status. So mainly my goal as a nutritionist is to see that you achieve a healthy weight status, alongside the psychological support.
And this is something that you do not just for the patient, but you do it together with the family, with the support system.
Yes.
And this you do at Nsambia Hospital. These services are available.
Yes, they are very much, I'm sure, I think many hospitals out there are now having people like nutritionists. I think we're in an era of specialism where there are many people, there are cardiologists, there are nephrologists. So it's a good thing that actually, as a psychologist, she deals with the mental issues, emotional, and as the nutritionist, I deal with the food. So actually, if you're in your field of expertise, you can actually give a patient something
Quality
good,
care.
Quality care, as Elizabeth has talked about.
Yeah,
Yes.
so as you share this, it's giving hope that actually, though it's a big problem, hope is not lost. So there is a place that we can run to, and actually people receive help, people are helped to get back to normal. And in many of the hospitals nowadays, we have actually nutritionists. Nutritionists work in close hand with the doctors and the nurses for you to get holistic care. I know we'll usually around this time we're almost nearing the end of the show. Anything you've left out that you would love to share with our viewers?
Yeah, what I would like to say is these days we are looking more of the preventive than the curative.
Yeah.
So if you can prevent something, it's actually way much better than curing it. So with all these specialists on board, I think people should come. Don't only wait when you have a problem. Don't only wait when you are diabetic, when you are hypertensive, that you come to seek the nutritionist services. Actually, come to me and ask me, how can I maintain a healthy weight status? Don't wait for the repercussions, then to remember, oh, actually, there's a nutritionist. Come to me before you actually get all these health problems. And I think I'd also like to, these specialists like nutritionists, it's something that people underlook. Mostly in hospitals, they look at having doctors and the nurses. But we also need these specialists on board as well, because these people really need a lot of help. It doesn't make sense for you as a doctor to give people the antihypertensive medicines, the diabetic drugs, without actually changing their nutrition, because they work in hand. If you are giving all this medication and the patient is not improving their dietary intake, of course you can't get good results. But with the help of the nutritionists and the medical professions and the psychologists, of course it's teamwork, we can actually achieve something good and promoting quality health. Yes, at the end of the day.
I like that particular bit. You're emphasizing why we need to have nutritionists on board. So for the medical people watching us out there, please, Felista and her colleagues really needed part of the team to help our clients. As we come to a close, advocacy. One of the, besides empowering people, our viewers, with information about their health, we also use this platform to advocate for these issues. Policymakers, many of them are watching us tonight, leaders in different aspects of life in this nation. So, Elizabeth, in the last minute, please just speak to all these people. Just speak to as many people as you want concerning these issues that have been neglected.
Okay. Me as a clinical psychologist, I believe that emotional psychological health is as important as physical health. Because once emotionally, psychologically, this person is stable, then we'll be able to adhere well to the medication or to any management. So I'm calling out for all of you watching us today to take note that we need to take care of our emotional psychological health, because many people do not know that actually it affects them, and actually it also produces the non-communicable diseases like cancer, diabetes, and so many others. So I'm calling all of you to please take note and seek help. Seek help not only physically but also emotionally. Like my colleague has talked about, many times people don't think that mental health or emotional psychological health is important. But I want to tell you that most of these illnesses actually inhale from inside to outside. Like emotionally, it affects the internal, the kidneys, the heart, because once your pressure is up, it goes for your heart. Inside. So by the time you're coming to take care of the physical and you're not taking care of the emotional, psychological, you find yourself actually dying.
Sometimes it's too late.
Yeah, it's too late, and you only take medicine, but not knowing that actually when I will be able to take care of the emotional, I'll be able to eat well, I'll be able to take my medication well. So we really need to take note that emotional, psychological health is as important as physical health.
Wow. Thank you very much, Elizabeth. Felista, as we come to a close, your parting shots.
Well, to the viewers out there, I would like to thank you very much for taking off your time to listen to watch this show. And of course, I would advocate for nutrition as well. Nutrition plays a very important role in all aspects of life, from childhood, adolescent stage, and adulthood. So the people watching out there, I would like you to know that we have nutritionists in this country. They recommend the things that people are supposed to eat in order to maintain a healthy lifestyle. So whenever you have the opportunity, feel free to come and check on a nutritionist in order to sustain your life and to live a quality life in the end. Yes, thank you.
Elizabeth Namukose, a clinical psychologist, and Felista Nakasita, a nutritionist within Zambia Hospital. Thank you for your time and sharing very important information. I hope you've been, something has been aroused inside of you. Probably will be now very intent on looking out for these signs and symptoms that have been mentioned. These issues are present with us, in our families, among our friends, but hope is not lost, because actually there are solutions. Solutions available in most of our hospitals. Let's look out for these symptoms and let's seek help while there's still time to do something about it. As always, it's a pleasure for me to host this show every Thursday evening. Dr. Joseph Garvin Nyanzi. And thank you for always allowing us into your living rooms, onto your phones, and wherever you are. Thank you for always sharing this information with your friends, always live on Facebook and YouTube, the Doctalk Show. And we appreciate our sponsors, Camelin Men's Collection, your favorite store for all men issues, the clothes, the footwear, and many other things, as well as the National Medical Stores, who every week make this show available to us. We'll see you again next Thursday. Always keep it here with us.
The Doctalk Show.